Welcome back to Florida Pediatric TV. Former Representative Sam Bell and I are here at the end of the 7th week of the 2013 session. Sam, one of the biggest questions on everyone's mind is the Affordable Care Act Medicaid expansion. That seems to change minute by minute. What's happened this time?
Well, it's interesting, even today as we broadcast this this video, the House Committee is dealing with the issue. Basically, as just to refresh everyone's memory, the federal government has proposed to expand Medicaid eligibility to adults up to 138% of poverty and fund that fully for 3 years and then at 90% for the next 7. So it would be a 10-year guaranteed funding. The House has rejected this idea entirely and has come up with its own plan that funds some people with only state general revenue. The Senate proposal, actually there are 2 Senate proposals. Senator Bean has a proposal that's similar to the House bill that funds some part of those newly eligibles with state money and no federal money. Senator Negron has a broader bill that pulls down the federal money and creates a program under the Healthy Kids program. We are hoping, of course, that plan survives in this last couple of weeks of the session.
And there are a number of bills that look like they actually are going to make it through. Distracted driving is one of the big successes this year. Where is that?
Distracted driving is on the calendar in both chambers, so we think that this next week we'll see that pass one way or the other and then go to the governor.
And then the epinephrine auto-injector to prevent anaphylaxis, that's moving also?
Yes, the Senate bill has passed the Senate and is in the House messages, so it's available for the House to take it up and send it to the governor.
And then another issue important to pediatricians is the pulse oximetry screening to detect severe critical heart disease. How's that?
The funding for that for DOH is in the budget. We're hoping that some proviso language is added that will clarify the role of DOH, but certainly the funding is there and we look forward to working with that issue after the session.
And another important issue is foster care normalization. I believe that's moving as well.
Yes, it's law, so it's moved out of the legislature and has now been signed by the governor.
Okay, and then another one is the sudden unexpected infant death bill.
Yes, that's in the hands of the governor right now, and our language that deals with the child protective teams stayed intact and is in the bill.
Now, last week we reported about the self-attestation process for the Medicaid physician fee increase, and as you all know, there was a big glitch in that. You had to change the pre-populated start date from April 1st back to January 1st, 2013 in order to receive retroactive payments. Why the Agency for Healthcare Administration did it that way, I'm not sure. It would have made a lot more sense to start the self-attestation date at the proper time. But there is a procedure for fixing that if you didn't do it correctly, and that's in emails, and contact me or the chapter office and we can send that to you. This week, a whole new series of glitches has surfaced. It appears that if you use the recommended procedure for billing for vaccine administration reimbursement for Medicaid kids, your claims are bounced. That is, if you bill, for example, a child health checkup and use the procedure that AAP has stated to get reimbursed for vaccine administration, which is 2 billings. One, the vaccine product code, which reimburses you $10 as in previous years, and then second, the appropriate vaccine administration code, which is supposed to reimburse the rest, in most cases another $16 and change to bring you up to the Affordable Care Act mandated $26. Your whole claim is bounced. We're working on that. I haven't heard a word from the Agency for Healthcare Administration. As you know, long before January 1st, we asked on 2 occasions to meet with the agency regarding the implementation in the hopes of preventing glitches like this. And on both occasions, our letters were answered by the Attorney General's office, who said, no, we can't meet with you. You have a pending lawsuit against the state. So just 3 days ago, Sam, on our behalf, contacted the Attorney General's office and requested a meeting specifically pointing out the self-attestation glitch, the immunization administration glitch, and there are some other issues like how does your nurse practitioner get reimbursed the new rates and so forth. Sam, as of this morning, we have no answer.
No answer as of this morning.
And all of this is extremely frustrating because we should have been able to prevent any of this from happening by having a discussion about what are the proper codes and how are they going to be processed and so forth. So stay tuned. We will try to get you some answers as soon as we can. Now, Sam, there are several issues that are dead this year as far as we can tell. Booster seats is one of those, and I guess that's an issue for next year.
Yes, unfortunately, we've been told that we were given distracted driving in lieu of booster seats, so that's I guess next year's issue.
I'm not sure how they decided that trade was appropriate, but I think kids are important whether it's distracted driving or booster seats. Also, the issue of salary parity for child protection teams was one we were hoping to get through, but it turns out even the department didn't support it, so that looks like another issue for next year.
Right.
And then there are two kid care bills, one about presumptive eligibility and the other about the non-citizen kid care eligibility, and I guess those are going nowhere as of this point.
Well, the bills are not moving, but we are still hoping that we can do something that will expand kid care to a certain group of non-citizens that are residing in the state, and we're working to amend either the Negron bill or put proviso language in the General Appropriations Bill. Also, we are continuing to look at the Negron bill as it affects children, since they're using Healthy Kids as the vehicle for that program. We're concerned that the emphasis will change from looking after the 250,000 children that are served with Title 21 to the million that is anticipated would be serving with Title 19. So we're looking at ways to help protect the emphasis on children, even though they're using Healthy Kids as the vehicle.
Well, that's it for this week. We'll be back next time with a wrap-up of the session. As before, let me know if there are questions or concerns, and by all means contact us about your experiences with the Medicaid physician fee increase process.